but I want to keep us moving. So I'm going to hand over at this point to a wonderful colleague, Jill Begg. So Jill, over to you, please.
Great, thank you, Aziz. If I can have my first slide, please. So COVID vaccine safety and effectiveness, as Aziz said, has been a bit of a national conversation over the last few years. If you think back to the excitement and at the prospect of the introduction of a vaccine that reduced the risk of COVID for our most vulnerable family members, through to the concerns that it was safe and the questions around the impact of new variants on vaccine safety, effectiveness, and the need for boosters. These are discussions happening in all of our homes, in our workplaces, and in our communities. So what you'll see in the research is, through this webinar, is that the research is very much focused on the data. However, behind the data, there were people, and the patient and public involvement was in place in this project to understand the questions and the concerns from the public, and to enable effective research and timely communication of the research outcomes. So I'm Jill, I'm one of 2 PPI leads in this project. I, along with Anthony Tutor and with the support of Tracy Jackson, who's our patient and public involvement and engagement coordinator at the University of Edinburgh, we developed a strategy with the support of the research team and working with patient groups across all 4 nations to add their questions, their concerns and their insights to the research work. We wanted to ensure that the public voice was heard across the project, with active participation in all project meetings, from weekly work package meetings through to monthly steering committee meetings. And we worked to ensure that the public contribution to project outputs, so some of that you've already seen from Aziz today in the scientific publications, but taking some of those and turning them into plain English summaries and infographics that help better explain the work to members of the public. But more importantly, across this work, we delivered a series of public workshops that help shape and support the work of the research teams. So if I can have my next slide, please. As Aziz has already outlined, this project followed on from some earlier work, but in this work in particular, we brought together adults and children from from across all 4 nations rather, to explore the questions and concerns around vaccine safety, in particular as highlighted by Aziz with respect to those who are pregnant, children and young people when given as booster dose and on the various variants of COVID. In order to do that, we brought together 4 workshop groups, 2 adult groups and a group of children and young people with whom we met twice across the project. All 4 groups had a guided discussion on the questions that you see on the screen in front of you, seeking really to understand the information that they wanted to learn about the vaccines, where they sourced their information from, and more importantly, actually, which sources they trusted for the information, and if there was any gaps in that information, what they wanted to learn but couldn't readily find the answer to. And then we closed by asking each group, was there anything else that they would like to share around the COVID vaccines? If I can have my next slide, please. For children and young people, we tried to make it as interactive as possible. And I can only say how impressed we as a team were by the children and young people that joined us. In order to help and support them, we actually asked them to take photographs or little snippets of the sources that they trust and put them onto a Padlet. And it was really interesting to see that the choices that the children and young people made were very much in line with government literature that was being shared at the time around COVID. Consistent with what we saw in adults and really very impressive. If I can have my next slide, please. For the other questions, though, there was a few differences. On the question of vaccine safety, adults were very much concerned about the safety and effectiveness of vaccines in people with long-term health conditions and the impact of the vaccine programme on those with learning disabilities, those from ethnic minorities and the immunocompromised. For children and young people, they were concerned about the side effects of vaccines and they wanted to see more of the risks more clearly explained to them. Our children and young people were a very curious group. They also wanted to know much more about how vaccines were developed, how they were approved so quickly and yet remained safe, and if there was a plan to extend the programme to their younger brothers and sisters. They also had lots of questions about how the pandemic would play out and the future of flu vaccines and COVID boosters. I think we generally got a group that would have loved to have been the researchers of the future, and it was a pleasure to work with them. So finally, from me, the past few years have been a rapidly changing picture of COVID. Lockdown, vaccines, new variants, more lockdowns, boosters, and it's been a time of rapid learning for us all. In this time, we as lay leads were welcomed as core members of the project team, invited to work alongside the team and encouraged to ask questions and suggest ideas. We thank the research team for their warm welcome, their time, their patience, and in answering all of the many questions that we posed. So thank you.
Great, thanks very much indeed, Jill, and thank you to you and all of the PPI team. Absolutely fantastic, important work that's gone on behind the scenes.